Bismillahirrahmanirrahim. Assalamu alaikum. Our today's lecture is the structures which are attached to the norma basalis. So one by one we will discuss the structures. So first we will study the structures which are attached anteriorly, and then we will study the structures which are attached to the medial part, and then we will study the structures which are attached to the posterior part. So first discuss the structures which are present anteriorly. So I will point three muscles are attached. I will point out the structure. Here I am marking. This is the posterior nasal spine. So on the posterior nasal spine, a muscle is attached, which is called the musculi uvuli. Basically, musculi uvuli is attached on the posterior nasal spine. And then you have the posterior border of this hard palate, posterior border of the hard palate, like this. So you have the attachment of palatine aponeurosis, and then you have a crest just behind it here, a crest which is basically just behind the posterior border, and the muscle attached here is the tensor veli palatini muscle. So three muscles are attached anteriorly: musculi uvuli, palatine aponeurosis, and the tensor veli palatini muscle. So let's come to this bone, which is the basilar part of the occipital bone. So three muscles are attached over here. One muscle is attached to this central point. This central point, here an elevation is present, you already know, and the name of this elevation is the pharyngeal tubercle. So on the pharyngeal tubercle you have the superior constrictor muscles attachment, which is attached through a raphe. So a raphe is attached to the pharyngeal tubercle, and this raphe is of superior constrictor muscle. Then go laterally on the superior side you have a muscle attachment, which is the longus capitis muscle. And if you go just behind the longus capitis, you have another muscle, which is basically the anterior fibers of the rectus capitis muscle. So this is the attachment present on the medial. So now we will go some lateral position. You know that this is the medial pterygoid plate. On the medial pterygoid plate, in the posterior surface of the medial pterygoid plate, like here a triangular projection is present, and the name of this projection is the procerus tuberous. The procerus tuberous is nothing but basically it is a triangular projection on the posterior surface of the medial pterygoid plate, and it supports the medial end of the cartilaginous part of the auditory tube, and just posterior to it, where I am pointing out, just posterior to the this procerus tuberous, and other structure which is attached is called the pharyngeo-basilar fascia. So pharyngeo-basilar fascia is attached just posterior to the procerus tuberous. Now on the lower part of the posterior border of the pterygoid humulus, this is the let me clear so that you can see easily. So you know that the name of this point is the pterygoid humulus. On the pterygoid humulus, the posterior part of the pterygoid humulus, you have the attachment of the pterygomandibular raphe. The posterior part of the pterygoid humulus gives the attachment of pterygomandibular raphe, and if you go just posterior to it, the humulus and the posterior border of the medial pterygoid blade. It gives the attachment of the superior constrictor muscles of the pharynx. The upper border of the posterior part of the medial pterygoid blade, the place where I am pointing out here, it is basically it is pierced by auditory tube. So auditory tube is present over here. Pterygospinous process is present on the middle of the medial pterygoid blade, where I am pointing out. So here the pterygospinous ligament is attached. So now we will study the structures which are attached to the lateral pterygoid blade. So this is the lateral pterygoid blade. This muscle which is attached lateral to the lateral pterygoid blade is the lateral pterygoid muscle, and the muscle which is attached to the medial wall of this lateral pterygoid blade is the medial pterygoid muscle. So very easy to memorize that lateral to the lateral surface is the lateral pterygoid, and medial to the lateral pterygoid blade is the medial pterygoid muscle. The greater wing of the sphenoid, this is the infratemporal region, and in the infratemporal region the greater wing of the sphenoid is also giving rise to some fibers of the lateral pterygoid muscle which I am pointing out, and this portion which is located in the greater wing of the sphenoid, infratemporal region of greater wing of sphenoid, basically it is pierced by the nerves of the temporalis and the masseter. So if we discuss about the spine of the sphenoid, so the spine of the sphenoid is going to give origin to the few muscles. So let me, where is brush? So the spine of the sphenoid is related to few nerves, and if we discuss the laterally the spine of the sphenoid is related to the auriculotemporal nerve, and medially it is related to the chorda tympanic nerve, and obviously the auditory canal is also passing medial to it. So this point, the tip of the spine of the sphenoid is giving attachment to the few ligaments like the sphenomandibular ligament and the anterior ligament of the malleus and the pterygospinous ligament. So three ligaments are just appearing from this tip of the spine, and two nerves are related. One is medial, one is lateral, and some fibers of the tensor veli palatini muscle is also originating from this spine. So let me tell you once again that the spine of the sphenoid is related to the three ligaments and two nerves and one muscle. So the portion which is very next to the spine of the sphenoid is the petrous part of this one, the petrous part of the temporal bone, and this is giving origin to a muscle which is the levator veli palatini. So let's come some posterior, because we have discussed the anterior part and the medial part, and now just come to the posterior part. In the posterior part, you know that here is the foramen magnum. So the margins of the foramen magnum are giving origin to are giving basically attachment to some fibers of the membrane. If we discuss the anterior part, this anterior part of the foramen magnum, so it is giving origin to the anterior and occipital membrane, And if we discuss the posterior part, this posterior part of this foramen magnum is giving attachment to the atlanto-occipital membrane. So anteriorly we have the atlanto-occipital, and posteriorly we have the atlanto-occipital membrane, which is anterior and posterior. And alar ligament is basically attached on the rough surface of this condyles, and these are the occipital condyles. You know that the rough surface of this medial surface is rough. Medial surface of this occipital condyle is rough, and medial surface is giving origin to the occipital condyles of the occipital condyles are giving basically attachment to a ligament, which is the alar ligament. And next we have the ligamentum nuchae. Ligamentum nuchae is attached to the external occipital protuberance. So I will raise it. Okay, now I will show external occipital protuberance is over here. Let me do. I can point out over here where I am pointing out. So external occipital protuberance is present over here, and on the external occipital protuberance you have the attachment of the ligamentum nuchae. So the rectus capitis muscle on the jugular process of the occipital bone. You know that this is the jugular process. So on the jugular process of the occipital bone you have the rectus capitis lateralis. So if you go backward, here is that the inferior knuckle line. So below the inferior knuckle line you have the attachment of two muscles. One is medial and one is lateral. So medially the rectus capitis posterior minor is attached, and laterally the rectus capitis posterior major is attached. This one is the major and this one is the minor. So if you know the mastoid process, you know that this is the process, this is the part where the mastoid process is present. So below the mastoid process, below the mastoid notch, here is the attachment of the digastric muscle. So we have discussed the structures which are present medially, anteriorly and posteriorly and laterally. So now we will study the structures which are passing through the different phenomena present in the norma basalis. So let's discuss the structures which are passing through this foramen. Anteriorly this foramen, somewhat above this foramen, this is the incisive foramen. So the vessels which are passing through the incisive foramen are basically the greater palatine vessels, and the nerve which is passing is the nasopalatine nerve. So one nerve is present, one nerve is passing, and one vessels are passing. Both are passing from the palate to the nose, and from nose to the palate. So if we discuss the structures which are passing through this foramen, which is the greater palatine foramen, so with the name of the same name as name of the foramen, the greater palatine vessels are passing, and the anterior palatine nerve is also passing through this foramen. Behind the greater palatine foramen, you know that here is the lesser palatine foramen. So in the lesser palatine foramen, the lesser palatine nerve and the middle palatine nerve and the posterior palatine nerves are passing through the lesser palatine foramen. So you know that here the palatino-vaginal canal is present in the, let me turn on the brush. So you know that here the palatino vaginal canal is present. So the structures which are passing through the palatino vaginal canal are the pterygopalatine ganglion and the pharyngeal branch of the maxillary artery. So just inferior to it, the vomerovaginal canal is present. You know that here it is present. So the structures which are passing through the vomerovaginal canal are the pharyngeal branch, and this is the pharyngeal branch coming from the pterygopalatine ganglion. So I have opened this picture for you to show you the structures which are passing through the different foramens. So first we will study or discuss the structures which are passing through this foramen, which is oval shaped, and the foramen veil. From the foramen veil, male is passing M-A-L-E. M is for the mandibular nerve, A is for the accessory meningeal artery, and L is for the lesser petrosal nerve, and A is for the emissary veins, and these emissary veins are connecting the cavernous sinus with the pterygoid plexus of the veins. Okay, so these are the structures which are basically passing from the foramen ovale. So let's come to the foramen spinosum. So you know that this foramen, which is a small foramen present lateral to this foramen ovale, is the foramen spinosum. From this foramen spinosum, the middle very important structure, which is the middle meningeal artery, which is passing. So I have found a very important and very beautiful picture which is showing you that anteriorly here is the emissary. Let me turn on the flash. Okay. Anteriorly here is the emissary sphenoidal foramen where the emissary veins are passing, and these emissary veins are basically connecting the cavernous sinus with the pterygoid plexus of the veins, and behind it big foramen is present, which is the foramen ovale, and from which the male structures are present, and behind it another foramen is present, and this foramen is called the Canaliculus innominatus, and from the Canaliculus innominatus the lesser petrosal nerve is passing. Okay, and behind it the foramen spinosum is present, and from this foramen spinosum the structures passing are the most important structure as the middle meningeal artery. So coming back to this picture, we are back to this picture to show you the Foramen Nasirum. This foramen, which is the Foramen Nasirum, and during lifetime it is basically covered with a cartilage, and from here the ascending pharyngeal artery is passing, and a emissary vein is also passing, which is the emissary vein behind the cavernous sinus. So the one important thing about the Foramen Nasirum I want to tell you that the internal carotid artery is also passing through it. The anterior part through the anterior part of this sinus, the internal carotid artery is also passing, and internal carotid artery is passing along with its sympathetic plexus and with its venous plexus. You know that it's a big artery, so around it venous plexus and sympathetic plexus is present. So the nerves and the veins around the plexus are passing with the artery through this foramen, and the lesser petrosal nerve and the deep petrosal nerve. The lesser petrosal and the deep petrosal, these are just uniting and forming the another nerve, which is basically the pterygoid nerve of the pterygoid canal. So in this foramen it is happening that two nerves are uniting and one nerve is forming, and this nerve is basically just going beyond, crossing this canal and just going beyond it. Okay, so this picture is shown. This picture I have opened for you to show you the Teleco tympanic fissure. This fissure, which is the Teleco tympanic fissure, also called the sphenotympanic fissure. Basically, this fissure is transmitting a nerve, which is the chorda tympanic nerve, and a ligament, which is the anterior ligament of malleolus, and it is also transmitting an artery, which is the anterior tympanic artery. So three structures are passing through this fissure, which is the chorda tympanic nerve, and the artery, which is the anterior tympanic artery, and the anterior ligament of the malleolus. So let's discuss about the big foramen, the biggest foramen, which is the Foramen Magnum. So this is the picture which is showing you the structures passing through the Foramen Magnum. So you can see in this picture that this is the interior part of the Foramen Magnum, and then the middle part, and then the posterior part. So three parts we can divide this Foramen Magnum as the structures passing through the anterior part are the apical ligament of the tens, and then you have the cruciate ligament. Basically it is the vertical band of the cruciate ligament, and then the membrana tecta. Basically the Foramen Magnum is a foramen which is oval shaped. It is narrow. You can see that it is narrow from the anterior side and broader than in the posterior. And from the anterior part we have discussed three structures which are passing the three ligaments. One is the apical ligament, and basically it is for the dens. And then we have the vertical band of the cruciate ligament, and then we have the membrane tecta, and then comes to the posterior part. This one good part is the posterior part, and in the posterior part you can discuss it in two parts. One is the middle and one is the posterior most. If we come to the middle, basically the lower part of the medulla oblongata is here. The medulla oblongata along with the three meninges is passing through this part. And if we come to the subcutaneous, the subarachnoid space, which is the space just behind the arachnoid matter of meninges branches, you know that the three branches of the meninges, the innermost is the arachnoid. So just below the arachnoid you can see the spinal accessory nerves. These are the nerves which are the spinal accessory nerves, and the vertebral arteries are also present. The vertebral arteries are basically two. The anterior and the posterior vertebral arteries are present over here, and some small arteries which are the sympathetic plexus around the vertebral arteries are also present. And spinal arteries, I have told you that the anterior and the posterior vertebral arteries, and you can see the vertebral arteries or the spinal arteries same. So I have found another beautiful picture for you which is showing you the Hypoglossal Canal, the Jugular Foramen, and the Foramen Magnum. So now we will study the structures which are passing through this canal, which is the Hypoglossal Canal. So from the hypoglossal canal, a very important nerve, which is the hypoglossal nerve, is passing. So very easy to memorize. The same name nerve is also passing through the foramen. So the meningeal branch of the hypoglossal nerve is also passing through it, which is basically a branch of the sensory fibers, which is coming from the cervical part of the spinal nerves, and it is for the dura mater. And one ascending artery, which is the pharyngeal artery, ascending pharyngeal artery, is also passing through this canal, and a vein, which is the emissary veins. And this emissary vein is between the sigmoid sinus and the internal jugular vein. The sinuses are also veins, and that's why it is connecting the two veins. One is the sigmoid sinus, and one is the internal jugular vein. So these two veins are connected by emissary veins, which is passing through this foramen, which we are discussing, the hypoglossal foramen. So again I am repeating that from the hypoglossal foramen a nerve is passing, which is the hypoglossal nerve, and emissary vein is passing, and an artery is also passing, which is the ascending pharyngeal artery. And the part of the hypoglossal nerve passing, it also has a branch of the sensory fiber, basically a fiber for the sensation, sensory fibers of the spinal nerve, and it is for the dura mater. So now come to the jugular foramen. In the jugular this is the jugular foramen. So the structures passing through the jugular foramen can be divided into three parts. One is the anterior, middle, and the posterior part. From the anterior part, the petrosal sinus, basically it is inferior petrosal sinus, is passing, and the meningeal branch of the ascending pharyngeal artery is passing. From the middle part, you have the 9th, 10th, and 11th cranial nerve, which are passing. So let's come to this part, which is the posterior part. From the posterior part, internal jugular vein is passing. From the vein named the jugular vein, basically the jugular foramen is given the name of the jugular foramen, because the jugular vein is passing from it. And then the meningeal branch of the occipital artery is also passing through the posterior part of this foramen. So the lateral wall of the mastoid canaliculi, this is the mastoid canaliculi. It is basically the lateral wall of this foramen, the jugular foramen. The lateral wall of the jugular foramen is the mastoid canaliculi, and it is involved in basically the transmission of the jugular jugular force, the lateral wall. And let me hear it, and I will go again and tell you again. The lateral wall of this jugular fossa is called the mastoid canaliculi, and it is involved in the transmission of the vagus nerve. The vagus nerve and the auricular branch of the vagus nerve passing under it and is appearing at the tympanic fissure. I will draw it over here for you like this. So let me clear it to you. This is the mastoid canaliculi, and the mastoid canaliculi is basically the lateral wall of the jugular fossa or the jugular foramen, and it is transmitting the auricular branch of the vagus nerve. and it is appearing at the tympanomastoid fissure. This is the tympanomastoid fissure. So this nerve is appearing over it. And let me tell you one more thing, that this nerve is just extracranial when the baby is born. So after birth, this is present outside the bone, but with the passage of time, the bones appears, the mastoid process appears, because you know that at birth the mastoid process is not present. So the mastoid process and the fissure appears, and so this bone is covered by the bone. So this nerve is covered by the bone. So now is the term of the tympanic canaliculi. What is the tympanic canaliculi? Basically, this is the carotid canal and this is the jugular foramen. So between the jugular foramen and the carotid canal, there is the tympanic canaliculi, and this tympanic canaliculi is involved in the transmission of the glossopharyngeal nerve, and this glossopharyngeal nerve is appearing in the middle ear cavity. Okay, so the tympanic canaliculi is present in between the carotid canal and the jugular fossa or the jugular foramen, and it is involved in the transmission of the glossopharyngeal nerve, which is appearing in the middle ear cavity. So now this is the last foramen. This is the foramen which is called the stylomastoid foramen, because you know that it is present on the between the styloid process and the mastoid process, so it is called the stylomastoid foramen. So the stylomastoid foramen is involved in the transmission of the facial nerve and the stylomastoid branch of the posterior auricular nerve. So two nerves are passing from here to the stylomastoid foramen. One is the facial nerve, and this is the facial nerve, and this is the stylomastoid branch of the posterior auricular artery. So one artery and one nerve is passing through this foramen, which is the stylomastoid foramen. The facial nerve is passing, and the posterior auricular artery is also passing. And which branch of the posterior auricular artery is passing? The stylomastoid branch. Okay, thank you. Hopefully you understood. This is all about the attachment of the attachments which are present on the inferior surface of the skull or the norma basalis. All the ligaments, all the muscles, all the membranes, all the structures which are passing through the foramens and fossas we have discussed everything in detail. If you people have any question, you can ask. Thank you so much. Allah Hafiz.